to the Student Health and Counseling Center. We're really glad to have you as incoming first years, and also really excited to talk about parents of incoming first years. And we want to tell you a little bit about our services this year. I'm Dr. Shelly Lear. I'm a licensed clinical psychologist, and I'm the director of Student Health and Counseling. And with me are our full-time clinicians. Heidi Ryan, who you will see on your screen, is our registered nurse. And below you will see Dr. Thomas Lindquist, who is also a licensed clinical psychologist, and the other staff psychologist is part of our counseling center. We've prepared a few answers to questions that we usually get from incoming first years and their parents, and so that's what we're going to talk about first. We'd encourage you, if you have any questions after all of this, to be in touch with us, either by email. You can find our email on our webpage. Our webpage is under the regular Watch Jeff page, under Student Life, and the Student Health and Counseling Center. You can find us there. And on the intranet, you can find us there as well. That'll be important when we talk about scheduling in a little bit. So in the meantime, why don't I start with you, Heidi, and ask you a little bit about what's the staffing of the health center like? Tell us a little bit about health services and how we provide services.
We are staffed with myself. I'm a full-time RN, and we have one part-time RN. Her name is Marcy Clue. We are supervised and have a collaborative effort with Washington Family Medicine, who is part of Washington Health Systems, and they are provide direct patient care should we need to refer a patient for a physician visit or nurse practitioner visit if it's something that we can't take care of on site. We also have a lot of various community partners that we can refer for specialty type care should we need an orthopedic referral or an ophthalmology referral or some type of gynecological care. We set up those things with our community partners locally in Washington.
How far away are those services, Heidi? How long does it take a student to get there?
Most of those are less than 5 minutes, and we do have our Campus of Public Safety Department will help transport students free of charge.
Great, thanks. And could you tell us a little bit about what kinds of healthcare do you usually provide on site? What kinds of things do students come to see you for usually?
On-site services are non-emergency services. So we see things and can treat urinary tract infections, pink eye. We do injections like Humira injections if you have an order for those, Depo-Provera injections. A lot of our female students have been on those for a period of time, and if their doctor provides them with the written script, we can continue those for them, and they do not have to leave the campus for those. We do a lot of triage and treat type things, rashes, burns, lacerations, sprains and strains, things of that nature that we can, as I said, triage and treat, those type of things. If it is bumped up to a higher level, if it's something that I look at and I'm not really sure what we need to do with it, that's when we refer those off to the physicians to treat.
Great.
If it's something that we do in our office on site, there is no fee for that. That service is free.
Great, thanks. And how about if I think I just need like an Advil or I want to get a decongestant?
We provide those medications. Those are also free of charge. We have a self-serve kiosk. If you think you know what you need and you don't need to see the nurse, but you ran out of your own supply of, say, Tylenol or ibuprofen, we have supplies of those in our office that you can come in and grab and go. We have Tylenol, ibuprofen, decongestants, generic Dayquil, condoms, things of that nature are available any time of the day that you can just reach in, grab and go. Or if we see you and we think those things are necessary, we will provide those for you, as well as eye drops for pink eye, antibiotics for urinary tract infections, things of that nature we have on hand and can administer to you.
And those are the self-service free?
Yes.
Thanks. And what kinds of things would we refer off campus? What kinds of conditions would we send to the local doctors, for instance?
Well, our providers would see students for ongoing things. If they need care for ongoing GI disturbances, abdominal pain, things that may need an order. So if you need lab work done that you do not have a prescription for, but you're feeling like I've had anemia in the past and I want to check up on that. If it's a injury that is persisting and I'm not sure anymore whether it's advanced and no longer just a sprain or a strain, and we want to get an x-ray look at that, we would need to see the doctor so that they can provide those orders. If we're doing a throat culture because of the COVID-19, those things are now going to be done at the doctor's office.
Okay.
So if we're going to do check for strep, those will be done at the doctor's office
And
now.
would the student have to make that appointment themselves, or
We
would
ma-
you?
we make all the arrangements for them as far as scheduling the appointment and the transportation. If the student does not have their own transportation, again, campus and public safety will
Great.
transport them and will also pick them up.
Great, that's great. So it sounds like we make it really easy for the student to get the care that they need, even if it's off-site.
Absolutely.
Okay, great, thanks. Thoughts about, often, especially for first-year students, this might be the first time that they're making their own visits to the physician. Can you say something about how we treat confidentiality in the health center, or any exceptions to that?
Confidentiality we treat very seriously. It's just like if you go to your regular doctor's office, we will not even confirm that you've been seen in our office to anybody. That includes parents, um, professors, anybody in student life. We tell no one that you've been there, and we will not confirm that you've been there. So if you want anyone to know that you've been in our office or give out any information, you have to sign a release of information giving us permission to do so. And I stress that because we frequently have parents calling to check on their child who has been sick and they're concerned, and I cannot give them information without that signed release. So that's very important for the student to know and for parents to know, because that information will not be given out. And
So if I want my mom to quit texting me and asking, have I seen the nurse yet, and prove that, I'll have to sign a release for you so that you can tell her.
Absolutely.
Okay. Thanks. I know that this year will be different because of the coronavirus. And so
Mhm.
I'm wondering, how does a student make an appointment with the nurse?
Well, this year we are doing telehealth. So you need to either go on the scheduler or phone our office, and we'll determine at that point how to get you on the schedule, what type of visit you need.
So a student can call, or they can make an online appointment and be
Absolutely.
seen first. And then
Hmm.
we'll decide whether we see who we see in person as
Exactly.
needed. Yeah. Okay, thanks. And I know that probably this question won't come up as much for counseling, but any other things that you would want students or parents to know about our strategies for coronavirus? Or
We will be keeping students updated on the most current information as we obtain it from the CDC and the Department of Health, our local Department of Health. So they have the most accurate and updated information. As information changes, we will make sure that they have that information.
what if a student
And
thinks that they have symptoms and they're worried about that?
they can contact our department and we will give them guidance. If we feel that they need tested, we have the means through our Washington Family Medicine. We will either have them seen by Washington Family Medicine or we will obtain orders to have them tested. That would be up to the doctors to determine which route we would go with that.
Okay, great. And last but not
Excuse
least,
me.
yeah, I know that, one of the reasons that our staff loves working at Washington and Jefferson is because really like working with college students and seeing them outside of our office as well. Can you say a little bit about what health service does for prevention and outreach to students, and
We
sort of fun workshops that we do?
Yeah, we tried to do a monthly workshop and we named them Finding Your Keys, and it was based on finding your keys to success. because we want students, it's much easier to stay healthy than to get healthy. So our philosophy is to try to teach and provide fun, interactive workshops monthly. So make sure that you're looking for advertisements. It will be marketed as Finding Your Keys. And as I said, we try to do something different every month. They're going to be web-based or virtual this year, and we will make them, they're always short, they're never more than an hour, and we gear them to what we have been told students are interested in for that month, and they will, that's one of the ways that we market it. We're also very involved with you in the Pres to Pres peer educator programs. That's how we try to educate and interact with the students as much as possible.
Great, thanks so much. Let's switch over to counseling and talk about counseling services. If you could say a little bit about staffing for us, Thomas, especially since
Sure.
you coordinate our training program.
Sure. So we're staffed by Dr. Lear and myself in terms of full-time clinicians, but we also have 3 doctoral level graduate students in training. So these are graduate students that are in their doctoral programs, and they work under our supervision. So they're also able to work with students. And then through some of the programs and outreach that we're starting to do more of, we're training some students to be supportive to other students. So that's a little bit separate from counseling, but it's also a helpful avenue for support.
And this year, since our services will be mostly virtual as well, we're hoping to get the students that we've already trained to be sort of peer helper counselors space to offer those services and support to students through Zoom, and then refer them to counseling when students are interested in pursuing that further. So we hope to get that up and running this year virtually. Can you say a little bit about what kinds of counseling we provide on site in the counseling center?
Sure. So we provide a short-term model of counseling, goal-focused and goal-oriented, but we will see anyone for an initial appointment and help determine what we can do to support them. So we have individual counseling, and that's typically weekly. Sometimes it takes a little bit more time to be seen in terms of how frequent it is. So sometimes it could be every 10 days if we're very busy. And we also have group therapy. I think last year we had up to 4 groups running, and we're hoping to do the same thing this year. Of course, that would be online also. In addition to those basic therapy services, we also provide more urgent care support. So students will be able to contact us if they're feeling that they're in a state of crisis or feeling overwhelmed, and we can see them more immediately through urgent care. We also provide consultation, so if students have questions about how to handle certain situations or concerns about a peer or a friend, they can contact us to consult about what would be the best avenue to address that.
Yeah, and how about emergency services after hours?
Right, so we also provide after hours emergency services in terms of if there is a high level of concern for student safety, for example, where one of us is on call 24 hours a day to be able to speak with the staff on campus, the professional staff, and also to speak with the student, evaluate the situation, and help make decisions about what needs to happen next.
How would a student get a hold of us after hours if they were having an emergency or they had a friend who was who might be having suicidal thoughts?
Yeah, students can easily get a hold of us by just calling campus and public safety. They can request to speak to the psychologist on call, and they would then provide a number for us to reach them. The campus and public safety will then contact us, provide the number, and then we'll reach out directly to the student to respond to their request for support.
Thanks. What kinds of cost is there for counseling at the center?
There is no cost involved. It's included as anyone who's a student is able to get services. So,
Great, thanks. And I know that confidentiality is really important to people when they're coming for counseling. Could you tell us a little bit about confidentiality and maybe any exceptions to that?
right. So similar to as Heidi was saying, we take it very seriously, and it would be like going to a clinic in a lot of ways anywhere else in terms of being separate from school. The only exception to confidentiality when you see a therapist or psychologist are around one would be risk. So if we're concerned about your life around suicide, or if we're concerned about you telling us that you're going to harm somebody else, we also are mandated reporters to report child abuse, other types of abuse. And in those situations, we may have to break confidentiality to either report something or involve other people to help protect yourself or others.
Thanks. And how do students make an appointment this year? Since
So we're all online, as I've said probably like 4 times. Students can go online to the website and simply click on schedule an appointment to schedule their first appointment. They can also call us and schedule an appointment that way.
what's
And
the phone number for us, from either of you, just in case a student needs to call us?
the phone number of the counseling center?
Yeah, of the Counseling and Health Center. I know it if you don't, but
Oh, well, I'd have to look it up.
it's 724-223-6107, and that will get you the main number, and you can ask for counseling or health or one of us in particular during the day. And then after hours, the number for campus and public safety is 724-223-6032. So if you need us, you can reach us one of those two ways 24/7 while school's in session. Thanks. What kinds of things might we refer students to a counselor off campus for?
Right. So sometimes the best course of action for students is to be referred off campus. Most of the time we do work with the students ourselves, but in some cases, for example, more of an active eating disorder that would possibly need a nutritionist and more intensive treatment than we can provide. That would be a situation where we refer off, sometimes around substance abuse. And a student who is looking to see a therapist every week just to kind of maintain ongoing counseling services, maybe they've done that in the past and just always had a therapy relationship with a therapist. In those cases, we might encourage students to seek off campus services, and we would help them find a provider for that, simply because we can't always guarantee that we could meet for the full year every week.
Mm-hmm. And it's true that we don't have any session limits, but we also make sure that any student can get in. So sometimes, right after midterms when things get busy, we might have to go 10 days or every 14 days until we can see the student again. So if a student really knows that they want to be seen every week for the whole year, it might be better for them to start with somebody outside that they can have a relationship with. But that will be up to the student and also the counselor to figure that out together, so that they don't have to just automatically go off campus just because they know they want to meet weekly at first. How many sessions does it usually take for students to see some improvement?
Well, typically, there's a couple of answers to that. I actually think that students can see improvement in one session in some ways, in terms of feeling of some immediate support and relief. Most students come, if they're going to be at more than once, usually they come maybe 5 or 6 sessions. And then there's a lot of research around 8 sessions being a time when things start to get improved more. Yeah. But I'm pretty confident that a student can come in and see us even for a single appointment, and we can help them move forward in whatever way that seems more positive for them.
And then probably the other thing is, what are some of the advantages of group therapy?
Sure. Well, group therapy is probably one of the treatment approaches of choice for us. Some of the things that are really great about it are the sense of universality or normalizing experiences. It can be very powerful to hear something from a peer. Students frequently comment about how they feel less alone, and they realize that other people are going through similar things, whether that's anxiety or just adjusting to college, missing home. difficulties with peers and friends, relationships. Um, we've had really positive feedback with groups, so we're excited to have that to offer again this semester online.
Great. What are some of the outreach and prevention things we like to be part of and that we offer?
Well, we do provide workshops, for example, and we're hoping to turn those into online workshops. Some examples might include managing anxiety, talking small talks, social relationships, mindfulness, procrastination. We also have a weekly mindfulness drop-in group, which will be moving online, where students can come and learn about meditation and practicing mindfulness. We do outreach around training, which Heidi mentioned briefly, what we call Pres to Pres, where we train other students to be peer supporters. So that's another opportunity that students who are interested in being helpers can learn about how to do that. And then we do a lot of things depending on the time of the year and what comes up that could be helpful for students. Sometimes attending other events and just being present there to help support the community.
Thanks. I think I forgot to ask either of you this, so I'll ask both of you. What if I'm a first year student who's still 17 and I won't turn 18 until January, for instance?
Well,
For us,
yeah, go ahead, Heidi.
sorry. For us, you have to have parental consent for us to see you. And we have those forms in our office for signature.
Similar to us, I think initially we don't, but we do eventually need it. I have to double check on the time length. There are a number of sessions, but in that case, we would still need consent from a parent.
We can always treat students in an emergency, no matter what. We will never not see a student because of age or other reasons. But we do need permission eventually. So if you're a 17-year-old and you're not interested in your parents knowing you're in counseling, we may be able to see you for a consultation early, and you may have to decide to wait until you're 18 if you really want that to be completely private.
For health services, it has to be a true emergency for me to see you, or if you're seeking treatment for an STD. Those are the only reasons I can see you without parental consent.
So I want to just take a few minutes and talk to parents directly too. So students, if you're bored by now, you can leave. I just want to talk to your parents for a moment. You know, we understand that helping students thrive means really working with all the people who are part of their regular support system. And we know that parents really know their young people better than we do, and that we're just meeting them. So we really count on you to be part of our health and wellness team. We would really invite you to be in touch with us if you have a concern about your young adult, whether that's a health concern or whether you're worried about their mood, whether you think they're too anxious, whether they seem lonely, all of those kinds of things. And we say that for two reasons. One of them is that we are aware of, in a way that you might not be aware, of other people who can be resources for them on campus. And we would be happy to help talk to you about what are other options they have in order to begin to resolve those problems, including academic concerns. We have a disability services office. We have, they have live-in residential supports and people we train to be peer helpers and supporters. And all of those kinds of things. So if you have a concern, don't be afraid to pick up the phone and call us and talk to us. We will either return your phone call right away, or we'll return it as soon as we have a free moment in that 24 hours. If it's an emergency, please say so, because we'll actually prioritize that, obviously. And then the other thing I would say is that sometimes this is the first child going off to college, and if that's your case, then it's probably important for you to understand that confidentiality changes from high school to college, so that because the law recognizes 18-year-olds and older as adults, it's their right to confidentiality, and they are the ones who have to decide who they're comfortable with knowing about their health or their counseling service. So we will always ask students, who else is would you like to be part of your support network, so that we can get releases up front for students when students are willing to sign. But if a student isn't willing to let that be you as part of their support team, then we will always answer that we can't say whether or not a student is using our services, but if you think that they are, encourage them to consider signing a consent form so that we could communicate with you. And parenting at this stage is often moving from that role of being the director to beginning to be the coach, and encouraging them to go in and play the position and giving them pointers about how to make appointments and those kinds of things. And we will be happy to work with you about sort of how to step back and give that responsibility to them, and then also to the resources on campus, so that they get the same care and concern that you're used to helping them get. And then eventually, hopefully by the time they're seniors, we want you to learn how to be consultants instead of even having to be coaches anymore. So the last thing I know parents want is a kid who's calling them in the middle of the night every night because they're anxious and they don't know how to get themselves to sleep. So I'd encourage you not to take 3 a.m. phone calls every night, and to call us for help about how we can together begin to help them learn how to do that for themselves. If you have any questions, like we said, please feel free to call us. Again, our office number is 724-223-6107, and we will be happy to talk with you and help in whatever way we can. Okay, thank you.
Thank you very much.
Thank you.